Yes.
Hi, everyone. Welcome to Monday night. Sorry we missed you last week, but we are back. And our good friend, Miss Linda, Nurse Linda, is here for Metro Drugs. And we're just going to kind of do what we do together. And that's just chat through all of this stuff with specifics towards the meds and the process we all go through with the meds we take, what the meds are, why we take them, all of that good stuff. So, Linda, welcome back. How have you been?
Thank you so much. Good to be here. I'm always happy to talk and support and hopefully provide some information to the CNY community. Let's keep it casual. Let's have like an open conversation with everyone, and let's take comments and let's chat through all of the things. Summer, everybody hopefully is getting through things.
Yes, definitely. Well, we are really super excited tonight because as a part of Linda's discussion with us here tonight, we are going to be giving away to one random person. If you drop a comment and an emoji in the comments at some point tonight, at the very end, we're going to pick one lucky winner at random to receive $200 off their full protocol order from Metro Drugs. So this is a big deal. Ask your questions. We're trying our hardest for tonight to really gear this towards medications. So all of your, it doesn't mean it has to be medication questions, but tonight we're really trying to focus on the meds, the side effects, what they are, how to take them, all of the above. So try to focus your questions if you can on medications. And then again, at the end of the broadcast, one person who drops a comment or an emoji with their kind of how they're feeling about it all, we'll draw at random and then we'll tag you and let you know that you've won $200 off of your full protocol order from Metro. So that's exciting. Hi to Leah and Monica and Gloria and Rosie and all the friends. Thank you all so much for coming. And again, tonight we're talking all about the medications. So let's just kind of start with I feel like one of the biggest questions I get, and I think sometimes we laugh, but it's a good question, is how are these injections given, and do I have to give them to myself?
Such a great question, because how do you know until you're in it, right? And it's underestimated. It's underestimated. I feel like it's fertility and the process. A lot is teamwork. It's teamwork between your fertility center. It's teamwork with your pharmacy. It's teamwork with your support system that you have at home, if you're solo, whatever it is. But yes, a lot does fall on the person who is going through the process. So yeah, let's talk about that. I mean, I think we should jump right in saying also, since it's summer, that whether you're starting cycle, in cycle, or even post procedures, it's really important to stay well hydrated because in general, crampiness and all those kind of things that are side effects can occur. And it's critical to help draw off the fluid and bloating and flush your system. And so staying well hydrated is so important. But to answer the question, and it's the beginner question, and it's so important, yes, the injections are self-administered. And that is followed up immediately with, yes, you can do them, right?
Yes, because that is the question that you get, right? Is, oh my gosh, I have to do these to myself. I can't do it. We are here to tell you that you can. It is so intimidating at first, but Linda, actually, I love having her on because she has some really good tips. And I've been an infertility nurse for maybe 7 years now. And before I met Linda, I had never heard of this, and I'm shocked. But one of Linda's favorite tips is, why don't you just tell people about this whole idea of like sort of introducing yourself to what the shot feels like, what it looks like. I love that the way that you kind of have patients familiarize themselves with just holding the needle and syringe.
Yes. So as I try to grab something really quick near me. So, one of the things that I feel like is helpful is just having exposure to something that's unfamiliar, that's uncomfortable. When I say, and we talk about this a lot, that you can do the shots, it does not mean we're minimizing how hard it is. And we're not minimizing that it's a challenge, and we're not minimizing that it's fun or comfortable, and or saying that it is. We know that it's not, but we are trying to empower each person to say, I've been doing this for 15 years. Elizabeth has been doing this for a really long time. I've sat with people shaking. I've sat with people who said their biggest fear in life is injections, and we get through it. And so some of the ways to do that is kind of thinking about what you can control versus what you can't control, right?
Mm-hmm.
What
I
can you
love
kind
that.
of grab hold of throughout this process? And so Elizabeth and I have a very shared philosophy in that the injection and
I lost your audio. I don't know if you all at home can still hear us. Linda, I lost you. Can everybody just give a heads up if you can hear us both or
am I back?
Oh, there you are. You're back. She's back. Technical difficulties.
Okay.
Carry on.
I was just about to say, these injections are your tools, and this is your toolkit, and it's something that's needed to just get you to the goal, right? And so we're going to work together to become familiar with this toolkit, to break down these tools, figure out how to use each one, because they aren't hurting us, although they're uncomfortable. They're helping us get to a goal. It's like kind of that mindset.
Absolutely.
So, you know,
Yep.
one of the things, like when you order, and I'm going to use Metro as an example, I partner with Metro Drugs. I'm their fertility nurse liaison, so I want to mention that. So when you get your medications from Metro, you'll have my card with my cell phone number in it that you can use. I get messages and text messages on Friday evenings. If I'm out to dinner, I run to the bathroom, I answer it, we jump on FaceTime, just to help serve as that go-between and build that comfort so that you're never on your own. So you will get, you know, a sharps container, which looks crazy. It's a biohazard container. Like, who's ever, right? If you're not a nurse or you're not in healthcare, this is all crazy stuff. You get a lot of syringes, you get a lot of needles. I usually say, and I don't have one in front of me, but let's just pretend that this is a syringe. I usually say when we start talking, just hold it in your hand. Just literally hold it in your hand, because I understand this, where I'm like, what do I do with this? And so I just want you to feel like you have control over it. It doesn't have control over you, right? So we talk about that. We talk about how we will break down what each medication is doing, how it's working in your body, the side effects. Like we could jump in and talk about Follistim. We could talk about progesterone and oil tonight, whatever you want to talk about. But each one has a purpose that is necessary to help get ultimately to that goal of having a beautiful, healthy baby.
Yeah. Well, let's do that. Let's go back to the beginning. So, you know, the medications, typically we talk about, the bulk of medications we talk about are for the stimulation for the IVF, because it just so happens that there's a lot more injections that are needed for the part to get your eggs retrieved than there are to actually do the transfer. So the most common medications for IVF are, and let's just talk about each one of them one by one. So the first one is the most common one. It's a stimulation drug. It helps to add to the output that's coming from your body's own pituitary gland in your brain, called FSH. So every month, your body actually has its own little FSH center. It sends FSH out as a little messenger to the ovaries, and that messenger FSH says, okay, guys, time to grow a follicle. A follicle, just one. So you don't want to travel to New York and undergo a surgical procedure for just one. If that's all we get, then that is great. But if we can, we like to add additional FSH into your body in the form of injections to increase that output, to increase the number of follicles. And that's most often done with a medication called Follistim, or Gonal-f is its counterpart. But we'll talk mostly about Follistim tonight because our partner Metro Drugs is here with us, and that's the medication that they're most familiar with. So talk to me, Linda, about FSH. Tell me, or about Follistim. Tell me about it. What do I need to know? I just got it. What do I do?
So Follistim, so I'll mention Follistim because it's the preferred FSH medication with Metro, because to be honest, it's more discounted, so it's more affordable. And it is, as Elizabeth explained, going to stimulate you by giving you FSH, follicle stimulating hormones, stimulating your follicles, right? Follicles are fluid-filled little things which contain an egg. When we do that, within a couple of days of taking that medication and injecting it daily, there are side effects that correspond with that. So fluid-filled ovaries that are expanding can make you feel bloated. So I would call that kind of like, for me, that seems to always be the number one side effect. What do you think? Do you agree?
Same.
So bloating.
Yeah, I'd say no. Bloating and headache are the two that I get. The bloating is really from the mechanism of action of the drug itself, which is growing follicles. Well, what does that follicle live in? Like Linda said, it's in a little fluid-filled blister. So as the follicles grow and the ovaries grow with all the follicles, there's lots of fluid inside. That's where the bloating comes from. However, when we stimulate and we grow all of those eggs are going to secrete a hormone called estrogen that we're all very familiar with. That estrogen is a sign of the follicles growing, but that estrogen can often give way to headaches. Do you hear that one a lot with the headaches? I know that was a big one for me.
Yes.
And I suffer from headaches, but I definitely I could tell it was an estrogen driven headache during stimulation.
I was just going to say, like, hormonal headaches are just a special level of hell, if we want to be honest with ourselves. And we're all friends, right?
Yes,
and
we are all
we're
friends.
Being casual about
yes.
it and real. I like to be real. And so as far as side effects go, along with bloating, I would also say headaches are way up there. Crampiness, especially when we're dehydrated and it's hot outside, like we are in this season in most parts of the country, can just become that feeling of sluggishness. And I usually say, look, we're adding hormones, so we're feeling pretty hormonal. Emotions are running high. There's a lot at stake emotionally, physically, and every way, financially, and which I never want to minimize. And so there's all those things together, and that kind of creates this perfect situation for just kind of not feeling like yourself. So if you exercise, you can continue to exercise with some provisions along the way. When you get to a certain point in that stim phase, maybe when you're midway through or so, you want to taper off some of the harder core exercise, right? You don't want to twist a lot because you want to avoid ovarian torsion. You don't want to do big bouncing exercises that are going to, cause difficulties, but you can feel easily. And I think it's important to say this, not in a fearful way, but in a way of like, okay, this is what I can expect to know, that like buttoning your pants gets harder, a couple of pounds, feeling just kind of bloated.
Yeah. And if you just normalize the why behind it. So again, your ovaries are little tiny little guys, not really, but in your pelvis, and they normally just kind of hang out there and you don't really notice them. But we're growing them. We're oftentimes doubling, tripling, quadrupling their size. That space is normally taken up with something else like bowel or your bladder. And so if you find you've got to urinate more, your bowels are kind of not behaving the way you expect them to be. This is all very common and expected because your body is doing what we asked it to do. And that is grow all these follicles to develop so that we can, harvest them and make them into beautiful embryos. So that it's such a good point that and again, we never want to minimize the fact that this process, a lot of it is really crummy. But at the same time, it's a means to an end. It's a step towards our goal. We got a good question that Leslie was asking, and I always say this, but when I put questions up on the screen, it kind of like hides my face. But Leslie was just asking, are there different meds depending upon age? Leslie's 42. She's looking to do IVF for tubal ligation. And that's such a great question. I know a little bit more towards my end than yours, but absolutely, Leslie. And we really pride ourselves here at CNY Fertility on every 42-year-old with a tubal ligation does not get the same protocol, meaning you do not get the same dosages of meds and things like that. So what we try to do is we try to look at your overall picture, including some lab values, age, all kinds of different things to determine what is that magic number of FSH or follistim, that injection we were talking about. What is that magic number that's going to essentially help grow the most number of follicles that your ovaries are capable of growing? And so, Leslie, that number for you is going to be different than for me, than for Linda, than anyone else watching tonight. And so I think, Linda, I think this is you and I that talk about this, but not this whole idea of, well, my friend is on 275 of follistim. Why am I only on 250? Why is that a bad thing, Linda? Why do we have to stop ourselves?
Okay. Yes. I'm so glad you said it because it was on the tip of my tongue. This was like the important point to take away from this. 42 tubal ligation, different situation than 46. I bet you didn't think I was going to say that. 46. Different than 32 with pre-ovarian failure, right? Everybody is coming to this with very different circumstances and variables. And so while it's so helpful, and Elizabeth and I just were talking about this, while it's so helpful to be able to bounce things off of people, did you do this? Did you get, were you prescribed this? Or did you experience this? That's great. But be mindful of vicariously taking on other people's experiences, traumas, and comments. Because while well-intended, and I do believe everyone in going through this is well-intended, that can really cause more confusion and stress and uncertainty. Like, well, why did she take that and I didn't? Maybe if I had taken that, this would have happened, or this wouldn't have happened, and it could drive you bonkers. So know that, like Elizabeth is saying, CNY takes all the factors into account and then determines a protocol that's right for you based on lots of different things.
Yep. No, it's so true that really, truly, and completely. And if you ever have questions about the appropriateness of adding this or doing this, please ask. We are the most accommodating IVF clinic that you will ever work with. We really do pride ourselves on making you an integral part of the process. It's your body, it's your time, it's your money, it's your process. So never fear asking or discussing it, but just know that the comparison can sometimes be a thief of joy, because if you hear something, right, that someone else did, and then you say, well, why am I not doing that? And so such good points, and very, very good question. Somebody else was asking, which kind of gives way to our next phase of med. So usually we do an FSH, or like a primary FSH, which is usually the follistim or the gonal-F. And then we use a second medication, usually I've never seen both, but it's usually either Menopur or HCG-LH. And somebody was saying, first time going through, starting stim Wednesday, super nervous. Very normal to be nervous. You should be nervous. So that's perfect. First time through IVF, you're going to do great. Confused with the HCG-LH. Linda, tell us, what does that come from Metro looking like? How's it done?
Yeah, let's talk about that. I actually would love, next time we get on, I'll have everything lined up. We can run through what everyone looks like and everything, and have that vial. But HCG-LH is HCG low dose. So it's used interchangeably, but it's very confusing. And it's just something that needs to be known. Similar to, follistim and gonal-F are the same. They're brand names, right? Coke versus Pepsi kind of thing. But in the sense that HCG-LH, if you see that on the vial, or you see that on your packing slip, or you see that in your patient portal, I'm not sure how it appears through CNY, is HCG low dose. So typically you will take that along with follistim, or you will take follistim and Menopur. But these things are working together as a team for stimulation purposes during this phase, to get your body moving towards the goal of maturing these eggs, getting them to a certain size, getting your body ready and prepared for retrieval. Yeah.
So, and just so for the person that asked that question, I apologize, I got off of it already. But so Menopur, the brand name Menopur, has FSH in it, which is that same drug we just talked about, follistim or gonal-F. That's just FSH. Menopur is FSH and some of an LH component.
LH. Yeah.
Right. So what we're trying to do is, HCG is, I forget the technical term, but it's an LH adjunct. It helps the body to produce LH. And that in turn helps to create nice, healthy, mature follicles that when we get them out, they're mature, they can be fertilized. And so it's always going to be an either or. So if you do Menopur, don't go looking through your box of medications for HCG-LH, and vice versa. And then the other big difference with HCG-LH is you're going to get one vial from which you will draw each day's dose. So you will draw today's dose, or you said you were starting that question. That person was starting, Janet is starting Wednesday. So Wednesday night, when you start your stimulation, you're going to take your HCGLH vial out of the refrigerator. You're going to use a little orange insulin syringe, and you're going to withdraw your dose, which would have been released to you in your written instructions. So every time you speak to us here at CNY Fertility, you speak to a nurse, we're going to tell you everything verbally. But I hear a lot of patients, and I get it because I'm that same patient that's like, hold on, let me get a piece of paper. And while you go get a piece of paper, no problem.
Mhm.
But please rest assured that us nurses are as detail oriented as you want to be. And so we're going to release to you written instructions. And those instructions are going to say, for Janet, they're going to say Wednesday, June 30th, take 20 units of, or whatever yours may be, 20 units of HCGLH. So each item is going to be listed on that list. So you're going to withdraw from that one vial, your units, whatever, it's usually 10, 20, or 30. So definitely pay attention to your own written instructions. But then you're going to take that vial and put it back in the refrigerator, and then you'll draw from it that same dosage each night. So the HCGLH is different from Menopur, comes in little single dose vials that you'll sort of mix and inject as you need them. Whereas the HCGLH, you're going to get one vial and you're going to draw each of your day's dosages out of that vial. So I think that's all I could think of.
That comes up a lot.
It does. It does. It comes up a lot. And I always get the question. I was even talking to a client this afternoon who was just kind of trying to understand the why between the two. And primarily, we will use HCGLH specifically because it's a lot more cost effective. So for some people, they need that extra FSH from the Menopur, but not everybody. And so we like to add that in because we're all about cost savings. We know that all of this comes at a huge financial burden to us all who go through this. And so that's a common reason why we use HCGLH. Not the only reason, but it's a common reason why, just because it's a lot more cost effective. So, okay. So next, let's see here. Next kind of set of medications that we'll talk about is the antagonist medication. So will you explain kind of what that is and why we use it?
Yeah. Can you guys hear my dog barking, by the way? I don't know if you can.
Oh, we totally can. He sounds like
sure. Willy Wonka says hello. He's sort of a mascot for everybody. So
perfect.
Somebody could just put him in a room. That would be got my kids.
No, we're keeping it. We're keeping it real. We're keeping it real. Willy Wonka.
We're all working together.
Everybody say hi, Willy Wonka.
Exactly. I just want to mention real quick, HCG low dose, as Elizabeth said, is a multi-dose vial. I know there can be some confusion when that's received. I can't speak for other pharmacies, but for Metro, it does come in a single vial. It says either HCG LH or HCG low dose. Menopur comes in a box that says Menopur. It has 5 vials of what look like water, and then 5 vials of powder, which are the actual medication and require mixing. So 2 different things, but all kind of working towards the same type of goal. At a certain point in the stimulation phase, depending on the size of your follicles, your estrogen level, CNY evaluates everything as you're progressing. You might be starting a medication called Ganirelix. And Ganirelix is something that I'm fond of because it's a pre-filled syringe, which is really nice. And so it's a pre-filled syringe. It's rather on the small side. All of these, we should mention, stim meds, Follistim, Gonal-F, Menopur, HCG-LH, which is HCG low dose, Ganirelix. All of these are subcutaneous injections. They are getting injected into fatty tissue. This is my little injection pad. You clean the area with an alcohol swab. You pinch up the skin and you inject. I have been asked, is there something I can do to really hurt myself? It's going into fatty tissue. You pinch up the skin and you just inject that amount, the full syringe full of the Ganirelix. But all of these are considered subcutaneous injections using a smaller needle. And to be honest with you, some bruising common at the injection site, maybe some stinging here and there. It's not that I haven't heard it. It's not super common. Just kind of bruising and soreness can happen at the injection site. But in general, from the side effects, I think what is above that we've already mentioned is that feeling bloated and feeling headachy. But ganirelix, as we're talking about, is something that you will start at a certain point. Your patient, as Elizabeth can explain, CNY will give you explicit instructions when to add that to your medications. Does CNY, Elizabeth, I think you've shared, is that done always in the morning?
Yeah, so we will always advise you when to start the antagonist medication, the Cetrotide or the ganirelix. Like Linda said, ganirelix is so nice because it's just pop off the little cap and inject it. There's no mixing, there's no fuss. It's great. So yes, that one. Now, if you're watching this and you all of a sudden are in a panic and you say, oh my gosh, I've been doing my Cetrotide or ganirelix at night, that is okay. Don't worry.
Yeah.
Effectiveness wise, it doesn't change morning versus night. We do it in the morning because we like there to be a gap on the day of trigger to take the Cetrotide in the morning, not too close to the trigger at night. So you'll always trigger in the evening, sometime between 9 p.m. and as late as every now and then. We don't like to do it this way, but as late as 2:30 in the morning. And so the ganirelix, we like it in the morning. So most people are going to start it around the 6th day of their stimulation. So they do the Gonal-F or the Follistim and the low dose HCG or the Menopur. They'll do that for about 5 days. And then usually around the 6th morning is when you'll start the ganirelix. And the idea behind it is your ovaries, we kind of talked about this earlier, your ovaries are used to making one follicle at a time, right? So in that case, your brain is fully in charge of when you ovulate. So your brain goes, oh, you seem to be ready. Let me send out my trusty friend LH. And that LH runs to your ovaries and says, okay, time to ovulate. Well, what happens is the brain gets very confused by this whole situation where all of a sudden now we have 20 follicles or 10 or 5 or whatever your number is growing in your ovaries. And that LH starts spiking and kicks those eggs out early. Well, we don't want that. We need those eggs to be available when we go in at your retrieval to get them. And so the ganirelix actually kind of puts the brakes on that LH and says, no, not yet. And then it's withdrawn, or you take the final dose that morning of trigger, because then at that point, we give you instructions, and we'll talk about triggers in a minute, but we give you instructions to trigger. And then that's the signal to your body. Okay, go ahead, LH, do your thing, and then part of the trigger actually, perpetuates that process. But it's really important when we give you the instructions to start the ganirelix or whichever antagonist you have, that it really be started when we advise. Starting it too early can actually slow down the growth of the follicles, whereas starting it too late we can actually lose follicles. So if we get there too late with the ganirelix and your LH has already spiked in your brain, there's a chance you may have ovulated one follicle or something. If that happens, it is not the end of the world, but if we can prevent it, we truly try to. And so
I love how you
that
just explained that the ganirelix and Cetrotide do that, because they just kind of put the brakes on things to just go, okay, we're stimulating, but we need a little control over stimulating. We can't just let this be a free-for-all.
Yep, exactly. And I sometimes give it the idea of we're putting the gas and the brakes on at the same time. Now in a car that makes a very unhappy sound, but in the body that works well, because we're still gassing up the ovaries with the FSH, with the Follistim or the Menopur or the low dose HCG, whatever we're using, but we're also putting the brakes on that LH so that we can get all the follicles to that right mature size, and then we say, okay, ganirelix out of the way, it's time to trigger. So that's kind of the idea behind the ganirelix. Now, Linda, I have never taken ganirelix myself. I only ever took the other brand Cetrotide. Does ganirelix cause a little itchiness on the skin?
It can.
Have you heard that?
And that's okay.
Okay. Yeah. Okay.
I have heard that. It's not uncommon. Other than that, I don't really hear too much difference. But yes, at injection site, that can happen.
Yeah, I always warn clients that usually I always say I know Cetrotide because I had to take that one myself, but the antagonist medication is not uncommon for it to leave a little red, itchy, like almost like a mosquito bite spot. As long as that stays nice and small and localized to the injection site, you're good. If that spreads in any way, or if you're worried, let us know. We will reassure you or have you seek further evaluation. But it's almost 9 times out of 10, it's okay. That's normal. It subsides in about an hour, and it's annoying while it lasts. So that's always my little kind of side tip with that medication, just because all of a sudden, right, we start experiencing itching and we assume something is definitely wrong. So, all right, awesome. So we've talked about how do we stim, how do we keep the brakes on to keep us from ovulating while we stim, and now let's talk about triggering and what that means. So the 2 primary trigger shots that we use are usually the HCG and the Lupron. So can you tell me what's that going to look like when it comes? And obviously I'll talk more about the timing and that type of thing, but just talk
100%.
us through what that's going to look like.
So depending on what you've been prescribed, you might receive a box that says Pregnal, because it's not that we want to overcomplicate things and add guessing games, but that is HCG. It's human chorionic gonadotropin. And as Elizabeth's going to go into detail and explain, that is going to be a very important injection. It's a timed injection. It's going to correspond with your retrieval, and it's going to be the final push, if you will, towards getting your body prepared for retrieval, getting like everything lined up. So it's very specific. When it comes as Pregnal HCG, it's in a box. It has a large vial that looks like water. It's bacteriostatic, and then also a powder. So it gets mixed similar to Menopur. If you've done Menopur before, you're going to get a specific dosage and instructions on how to mix that and then administer that. The Lupron trigger comes from Metro specifically as a vial, and you will have enough in there to do 2 Lupron triggers if needed. So depending on what you're prescribed, that's kind of how they both look. I am very much a proponent and advocate for, you are putting so much effort into the cycle, so much is riding on it, that if you have any questions, especially about your trigger shots, do not hesitate to contact me. If you got it through Metro, reach out to the patient through the patient portal, the CNY, because we want to make sure that any questions are answered so that you're set up for success.
Absolutely. Yeah, no, that cannot be understated, that the trigger time determines the retrieval time. They are married. And so if you trigger 30 minutes early, your eggs are going to be sort of due to ovulate 30 minutes early. Again, 30 minutes on either side is probably not going to make a huge difference. But if we tell you your trigger time is 1 o'clock in the morning and you oversleep and you don't trigger until 4 o'clock in the morning, that's going to be a problem, because now you've triggered 3 hours late. If we try to go in and do your retrieval at your normally scheduled time, your eggs aren't going to be ready. They haven't had the appropriate amount of time to, 1, go through their final stage of maturing. So that's the first part of what the trigger shot is intended to do, is to serve as a signal to all of those eggs that we've worked so hard to develop. It's saying, okay, we're coming for you. I need you to, 1, release from the wall of the follicle. So normally an egg is sort of attached by a little beanstalk to the edge of the follicle. Well, what the trigger serves to do is to sort of cut that beanstalk off and make that egg free floating in the fluid that's inside the follicle. So you've got a follicle, it's filled with fluid. Inside that fluid is your little egg kind of on its little beanstalk. And when you tell it to trigger, now that egg is free floating in the fluid, so that when we extract the fluid out comes the egg. So that retrieval time is married. So it's 35 hours precisely. If you get a trigger time for 32 hours or 36 hours, is a very specific reason, because you've either come to a retrieval before and all your eggs were gone, or you've come to a retrieval and none of your eggs were available. And unfortunately, that's the type of situation that almost everybody is a 35, 36 hour trigger. But again, if you're given a different time, feel free to clarify. But as a general rule, I would say 95% of all people that come through Seeing My Fertility are a 35-hour trigger. So what that means is if I give you a retrieval date of Wednesday morning at 8 a.m., you're going to trigger tonight at 9 p.m. So 1 hour less than 36 hours. The other really important thing to talk about when it comes to triggers is there are two separate medications. And in fact, there's different brands of HCG. So there's two different categories of trigger. One is Leuprolide or Lupron. It comes in a kit. It sometimes comes in a vial. But then there's also the HCG component, which is that human chorionic gonadotropin. And that one will come by several names. So I don't want you all to feel, some very sweet patient said, first time IVFer feeling very intense. Eugenia, you are not alone. It is intense. It feels like a lot. And so take tonight's information as just that. It's information. But like Linda and I always talk about, you're going to get a toolbox from Metro Drugs. When you order your drugs and you order your meds and they come to you, you're going to think of that like a toolbox. Okay. And then your nurse, we're going to be your project manager. And we're going to tell you each step of the way, okay, I need you to access this screwdriver, this wrench, and a couple of nails. And then we're going to use those. And then we'll let you know when we get to the next phase of the project, what's next. And so I don't want, we want to give you this information to help you to kind of demystify some things, but we certainly don't want you to leave here crying in the corner that you feel like you can't do this, because I promise you, you can. So real quick, I'll finish on the triggers. So just know that there's two primary different medications for trigger. You might use just one, just the other, or some combination of both. And that decision is based on you personally. So many clinics will trigger everybody with 10,000 units of HCG, show up on Wednesday for your retrieval, and we get what we get. Here, we really customize each individual person's trigger to their body, their age, their AMH level, the number of mature follicles they have, past cycles and that amount of data. So just know when you get your trigger shot, that's probably the worst time to compare with other people, because then you're in the moment. It's 10 p.m. on trigger night and you're supposed to trigger, and all of a sudden you go, oh my gosh, my sister said she triggered with 2 Luprons, but my instruction only says 1 Lupron. Oh my gosh. So it's always really, truly very important to follow the instructions that the nurse gives you. And when in doubt, reach out. So if you get your drugs from Metro, reach out to Linda. You can reach her at Unboxed Mom on Instagram. She's very responsive to her DMs. Does Metro have an after hours line they can reach you through?
It does, but for CNY specifically, where I love, I want to show the love. So when you get your meds, you will have my cell phone number. So just text me and we will do this. And like I said, I've done it Sunday nights, late at night, all those things. I have people say, I'm sorry. And I'm like, don't be sorry. I would be.
That's what I'm here for.
Situation. And to piggyback on what Elizabeth is saying is, you've got your project managers, you have your doctors. I like to say, like, I'm an added cheerleader, right? I'm here for emotional support. I'm here for clinical information. I'm here to bounce ideas off of all those type of things. But most important is especially to our first time IVFers, this is not all going to hit you on day one. This is a process that is going to unfold. So what you're going to get on day one, you focus on that. And I always say, you don't have to look too far ahead. It can be overwhelming for anyone. And so focus on, these are my instructions here and now. I'm going to think 2 or 3 days out, maybe. But as far as accumulating all of this, it is absolutely information overload. There's no doubt about it.
100%.
So let's, understand that, break that down. And also, I feel like it's important to become aware early on in the process, or maybe if you've already been through it a few times and it's just gotten really overwhelming. 2 is not always better than 1 when it comes to medication. More is not always better than, and less is not necessarily better. And 1 is not a sign of something else. It is dependent on, as Elizabeth said, so many factors. And what is your estrogen level? And what is your age? How are you responding? you may be under responding in the beginning, you may be over responding, but this is like a slow and steady wins the race.
Yep.
I always say it's not. I personally try to propose the idea that quantity is not always over quality. I have seen people go into this and come out with a basket of 16 eggs. And I've seen somebody come out with a basket of 4 eggs and be devastated. But guess what? When it came time for transfer, they ended up with the same amount because variable factors.
Yeah.
So you need to protect that. You are doing everything you can. You have support behind you. We are all hoping for a wonderful, beautiful, fantastic outcome. It is okay to break down. It is okay to feel however you feel. It is okay. It is also okay to kind of space yourself out when something that you're around is not getting where you're at, or is not able to understand, where it's difficult that you just got invited to the baby shower, or it's difficult even if your sister is, talking about how all you need to do is just, give it some time and it'll just be, I've heard, every scenario. And again, it usually is well-meaning, it's usually well-intentioned, but it can break us down and it can really hurt. And so just know that we do understand that, and we're here for you.
Yeah, absolutely. It is, couldn't have been better said. And I think, how do you usually say it, Linda? I love the phrase, protect your peace. Is that what you call it?
Protect your peace. Yes.
Yeah.
I'm all about seeking out support, doing the thing. I say this is when you start your stim meds, whether you're doing your first IVF cycle or your 5th, it doesn't matter. You need to be kind to yourself. And like, we could talk about like specific clinical stuff, medical stuff all day long, but I do feel like it's equally as important to address the fact that you're doing something that you're investing a lot in from every aspect of your life, and it's impacting you. It's a special time. It's sort of the beginning phase toward motherhood, and take care of yourself. If you have a partner, do things like just treat yourselves well, right? Like, treat yourself to something and let yourself do that, because you deserve it. And it's a great way to get into that phase so that when you do become a mom and it happens, you remember to take care of yourself too.
Exactly. And you give yourself
conditioning.
Yeah. And look, we recognize, more than it's one of the reasons that I'm so passionate about CNY fertility, is because I really do value the fact that we make this the most affordable that exists, basically. And so we get that, when you hear, oh, treat yourself, oh, I'd love to, oh, sure, I have plenty of extra money for this or that. It doesn't even come down to that.
Yeah.
Go take a bath. Go relax and take a bath, or read a book, or just focus on some mindfulness. There's so many things that you can do. But part of protecting your peace is not allowing outside distractors from stealing that from you, because it feels like a runaway train sometimes.
Yeah.
And if you allow the naysayers and if you allow the distractors to say whatever it is that they have to say, and again, most of the time people are very well-meaning, and anything that comes across, we don't receive it well, doesn't necessarily mean it wasn't presented well, but for the most part people do. But they also have not walked in your shoes, and they do not know what this is like for you. I tell everybody that not a single one of us ever, when we were growing up, played house or thought about being a mother. This was never a part of it. Injections,
100%.
Invasive ultrasounds and procedures, none of this was a part of that. And so we have to recognize that this is hard. And also that our lives don't stop because we're going through this. So in addition to everything else you have to do, work, relationship, if it exists, any other things you have to do, this is all comes on top of all of this other stuff. And then we inject ourselves full of hormones, and what's that going to do? And so you must be kind to yourself. You must be kind to yourself, and you must protect that peace wherever it is for you. You've got to protect it, because if you don't, it will drive you mad. It really will.
Let me put this out there too. When I say treat yourself or protect your peace, I actually also mean it as Because God knows I would love to do like retail therapy, but I can't, right? We can't. But I would say protecting peace could mean stop scrolling,
Mm-hmm.
stop accumulating, like, or taking on other people's fears or nerves
Mm-hmm.
or vicarious trauma of what they've been through that now you're worried about that you could go through. And taking care of yourself could mean like an extra 15 minutes in bed in the morning, or like
Yeah.
trying that meditation that you are kind of like, I don't know, just try it. And I want to go back to one other thing, which is from a financial perspective. I want to mention that we do realize, and we love that CNY is makes it hopefully possible. I know sometimes it's like this is all the eggs are in the basket as far as giving this a shot, and it's grabbing what you can and saving where you can. I want to mention with Metro Drugs, and I say this as a nurse advocate partnering with them. Think about where you get your information from. Think about where you get your medications from. Medications are stored a certain way to maintain their integrity and maintain their potency and things like that. So I can speak from, I know there's certain options out there that you can acquire medications, but you don't know if they've been at room temperature. You don't know how long, you don't know how they were shipped, all that kind of stuff. So I do want to mention that, but that's from a clinical standpoint, that's important. From what you receive, having additional syringes, needles, all that kind of stuff. Things are labeled a certain way so that to refrigerate certain things. So like I said, they can remain stable, that they can remain potent so that they work in the way they're intended to work in your body, and that there's no risk that you're investing in this and not getting the full effect that you want to be. So as far as packaging goes and things like that, from our perspective, we ship everything with kangaroo packages that self-inflate, and then they have a temperature gauge tracker and all this kind of stuff. And why? Because it's important. Because we want to make sure that you get everything you need and the best quality that you need it for to have the best outcome. That being said, should we talk about progesterone and oil? Because I feel like that's our last.
We should, and that I was going to say, and that one has been a very popular question. So let's do it. Let's demystify it. Because I feel like it's not a fun thing. It's really not. However, having done 70 injections all to myself and survived it, here to tell about it, it really is doable. So tell me all your tips.
Okay, progesterone and oil. It's oil-based. It comes in different forms of oil: olive oil, sesame oil, ethyl oleate. These are all compounded medications. So for Metro, for example, you might know that you had an allergy. We need to switch it. What is an allergy? It could be that it's irritated at the skin, at the injection site. It's itching. There's hives, things like that. From a standpoint of progesterone and oil and how it works, and I know, Elizabeth, you explained this beautifully, your body's not being triggered in the normal way it would be to produce progesterone, which is necessary to maintain, support, and continue a pregnancy. So while we would love for this to not be necessary, it's absolutely a necessary medication. And that's why we get behind it and kind of create a sort of like,
you got to do it.
Deep breath. We're going to do this.
Yeah.
Right?
So
we're going to do it. So PIO, progesterone and oil,
and let me pause you there super quick, because I really think what you just said is so important. Yeah. And I have actually seen at a client a very, very long time ago and I was telling another client about this today on the phone, but it was this whole, is it really necessary? Right. And so this patient I had years ago, she was reading on the internet that you should not take progesterone if you're pregnant. Progesterone and oil, I guess, specifically. And if you look deeply into your package inserts, you might see that somewhere, okay? But like Linda said, if you don't, and no, it is not the same thing as 17-OHP progesterone. It is not the same. It is not. But someone asked that. I just wanted to throw that out there. Not the same as 17P. So in a normal is the wrong word. In a spontaneous conception where you ovulate an egg, that egg meets up with sperm, and then that egg becomes a fertilized egg, becomes an embryo, an implant. Your body knows exactly what you need, what that baby needs. So that egg from which you ovulated, that follicle, becomes what's called a corpus luteum. And it's actually quite brilliant of our bodies to have its own little internal hormone factory to support a pregnancy. It's really quite awesome. So that corpus luteum hangs out in your ovaries, and it secretes estrogen and progesterone in just the right amounts to make sure that that pregnancy is sustained until you get to around 8 weeks. 10 weeks of pregnancy, at which time the placenta takes over the development. Okay. So now let's talk about a frozen transfer where you ovulated. Your eggs have been in New York or Colorado or wherever. You didn't ovulate. Now that estrogen and progesterone is only coming from one place, and that's from the outside. So those estrace pills or patches or shots, whatever you're taking for your estrogen, and those PIO injections, those are the only thing sustaining the pregnancy. Yeah. So much so that if you get pregnant from an IVF cycle, from an FET, from a frozen transfer, and you decide to stop your progesterone altogether at 6-7 weeks, there is a very, very, very strong likelihood that you will miscarry. So when we tell you that the estrogen and progesterone are critical, we cannot overstate that enough. Because that was what I was kind of getting towards, is I had another patient last week on Friday, who told me that she lost a pregnancy that way because she didn't know how important it was. She ran out, she ordered more, but in the process of waiting for more, she miscarried. Yeah. And so truly and completely, we cannot express that enough. So, but now let's talk about, and Leslie asks the number one question, which is, why do people get so nervous about it? Show us why. That's a great
question, Leslie. Oh yeah. The reason why is because you are doing it daily. And here's you're hopefully doing it for quite a long time daily. But it is an IM injection. So it's not the subcutaneous injections we've been talking about. It's IM, which stands for intramuscular. So it's being injected into the muscle, and the needle, straight up, because I'm honest and I'm supportive and all those kind of things, and I don't sugarcoat it, is it's a large needle. I give myself the IM injections for another reason. I don't enjoy them. They're not fun in any way, shape, or form. They are necessary and doable. So the way that I frame it is, it's one thing that you're doing specifically to help support, maintain a pregnancy, right? It's building a thick uterine lining. That thick uterine lining is needed for implantation. It's needed to help support the pregnancy. It helps it to maintain it for a long time. Mm-hmm. So progesterone oil is a multi-dose vial. It comes 50 milligrams per ml. And depending on your dose from CNY, let's say it's 1 ml, you'll get mixing needles, which if you have your meds at home, it's probably a pink little labeled needle. It's about 1.5 inches. And that's mixed because oil is thick and it takes a while to withdraw it into the syringe. So you go ahead and you twist off whatever needles on your syringe. Typically it's a 3 ml syringe. You put that needle to the side and you put on your mixing needle. And then you actually go ahead and you draw up your dosage for your progesterone and oil. You twist off the mixing needle. Let's say it's the pink one, which is probably it is, if you got it for Metro especially. You twist on a fresh needle because it's actually going to hurt less. It's also thinner. It's usually a 22 gauge, 1.5 inch. And then you're going to inject that. Now, I've drawn circles on people using Sharpies. I've done it over FaceTime where I jump on and they're standing in their kitchen, they're laying on their bed. From a bullseye standpoint, once you have the spots, it's in your butt, on your backside, kind of upper outer quadrants. I usually describe it, if you're wearing jeans right now, your upper outer jeans pockets, maybe a little above that. But this particular injection is slow to inject. You will be sore, 100%. This isn't you might be sore. You'll be sore. There are things we can do. We could spend 20 minutes talking about how to help with progesterone oil. Here are my top couple of tips. You can ice it beforehand if you want to. And Elizabeth, please chime in if you feel like that helped you, or if you did that or didn't do that. But you 100%. Don't want to ice afterwards.
Yeah, don't ice afterwards, but I will tell you, I tell everybody, I packaged the mixing needle, the injecting needle, an alcohol wipe, and a syringe into a little plastic Ziploc bag. And then I put that bag inside of a second Ziploc bag so that I could take the supplies out and fill the first plastic bag with ice. Because no matter where you are, convenience store, restaurant, home, wherever, hotel, you can get ice. Even on an airplane, may I have a cup of ice? Fill your bag with the ice and stick it on that spot while you mix it. Ice was my saving grace. Carry on. But don't ice it after.
Okay. So we've got votes for ice before. I have to say before, ice before. It's going to numb your skin at least. Okay. When you do the injection, again, this is where it comes in handy. If I'm talking to you on the phone, I'm going to ask you to just hold it in your hand. Just become like a pen. Just start to become familiar and just become aware of it, right? What you're going to do when you inject with progesterone oil is you're actually going to, and for all these I say this, but you're going to hold it up here, dangle it down here. We don't have as much control. But here we are like kind of choking up on it. And you will stretch the skin, go straight in, and then push down to inject, and then pull it straight out. Afterwards, you want to use warm, moist heat, the opposite of ice. You want to make sure, a washcloth, a wet washcloth that's warm, massage that area in a circular motion. It's going to help disperse the oil into the muscle. Move around a little bit. Don't just lay down and go to sleep or sit down, because what can happen with that oil is it can clump under the skin and almost like crystallize and form these little like knots that feel like bruises, and they're not fun. And so this can help eliminate that, or at least reduce that chance. When you're doing the injection, if you're self-administering it or you have someone administering it, lean against something. Because if someone's coming at me with something sharp, I'm going to jump. My natural instinct is to get away from it. So lean against something, maybe bend over so that skin is stretched, because the smoother it goes in, the less painful it is. Pushing something in very slowly can hurt more than if you just dart it with a darting action with your wrist straight in. But the warm, moist heat, move around afterwards. Be aware of what side feels, I guess, a little better. Sometimes I've had millions of things, 2 days on one side, 2 days on the other, 1 week on one side, 1 week on the other, every other day, whatever can work for you. But just know going into it that it's necessary, and like, look how far you've come at that point.
Yeah, I always say that I had a countdown on my phone of how many progesterone shots I had left. And it literally became almost like, I wouldn't say I looked forward to it, but it was like a rite of passage, because I was like, oh my gosh, I'm one shot closer. I'm one shot closer. I'm one shot closer. So Sarah was asking, I think this was her, she's seen that people heat up the oil to help the pain in a heating pad. What are your thoughts on that?
Yeah, so I don't like to advise that, because I feel like it adds risk to, is it going to get too hot? Is it going to destabilize? Is it good for it? Or is it going to like get too hot and burn you, let alone cause problem with the medication? What I do say, and I used to give these injections in clinic, but what I do say is you can take the vial, and you don't want to shake it around, but you could certainly keep it with you in your hand and kind of just like get it to a little bit of a warmer temperature that way. That's usually all I recommend from a temperature standpoint. I agree with you, it shouldn't be cold, because it's an oil, so you don't want it cold. But if you can, kind of just keep it in your hand. It will warm up a little bit that way. And sort of, I say this sensitively and with care, but consider when you're doing it. There are times when I've had people just breaking down saying it's hard to keep doing it because it's really sore. I totally understand, but it's really lucky to be able to do it, right? Because somebody's wishing they could be doing it, and so it's something that's necessary. That's a great question about warming it up. I wouldn't advise warming it up. I think
I wouldn't warm it in a heating pad.
Cause some problems. It does say. Yeah, it's a store at room temperature, so I think we're good at that. And I don't think it's going to really do much for it to be warm in terms of really helping.
Yeah. So I always
Do you
like
agree?
to yeah, I totally do. I always like to bring up the fact that as my own little science project, not really, but when I was going through infertility treatment, I was a pretty new infertility nurse, and I tried different things. Like, let me try the, the fall stim that I had kept in the refrigerator. People said, "Oh, it's going to hurt so much worse if it's cold."
Yeah.
So I tried cold versus warm. Not really a big difference. I did the same with the progesterone. So I never heated it in a heating pad, but I had received some, and ladies, you're going to think this is hilarious, but I had received some suggestions to tuck it in my shirt and let it warm up, if you get my drift. While I was mixing it, it didn't really seem to make any substantial difference. And so I think if anything, it may have been a bit of a placebo effect, but truly icing the skin beforehand that was the thing that made the most difference. And then I always try to advise people after you give the injection, try to, if you have stairs in your house, go up and down the stairs a couple of times. Just get that muscle working. If you don't, lay in bed on the opposite side of the side you injected and just do some leg lifts on the side. Just raise and lower your leg on the side. And that really will help kind of getting that moving. Sarah's asking, how long did you ice beforehand? A while. I mean, you got to be careful. You don't want to give yourself like an ice pack burn. But it was a good several minutes. And I can't recall, it was some time ago, but I definitely found kind of a sweet spot. But I basically just, before I mixed anything and switched the needles on and off, I just stuck that ice pack there. And then probably about the amount of time it took me to draw it up and switch the needles, and then maybe an extra minute or two. But you'll kind of find your groove. There's a couple of questions about timing. Rosie is asking, when is the best time? The best time is the time that you can stick with every day. So here at CNY Fertility, unless you do an ERA or an ER peak test, which is a test to determine the exact amount of hours you need for your progesterone. So unless you did one of those tests, we try to give everybody a standard 120 hours plus or minus 3. That's for a blast embryo. It gets adjusted if you have day 3s. But in any case, most people were going to tell you 11 a.m. on the first day that we tell you to start it. You're going to start your vaginal progesterone, and then you can start your progesterone injections at whatever time that day you want. So it's not the time of day that makes it effective. It's the same time each day, which leads into the next question, which was I think it was kind of like, how important is it to do it at the same time each night? It's pretty important. So the progesterone in oil is the gold standard because it's oil. It's absorbed slowly and steadily. And so you want to get to a point where your body knows it's getting its steady dose of progesterone at the same time each night. If you're off by 30 to 45 minutes, I think that's fine. But I know when I was going through it, I stuck as absolutely closely to my 7 p.m., which was my nightly time, every single night. And almost as like a matter of pride, like, okay, it's time, we're doing this. And so again, 30 to 45 minutes on either way, I think is probably fine. But hours difference is not fine, because then your blood levels of progesterone, instead of looking like this, they look like this. And those fluctuations in progesterone can cause you to bleed, different stuff like that. So it is really important to try to get that on a nice, steady schedule. Anything to add there, Linda?
100%.
Awesome. Yeah. And Christy actually added rubbing the area very roughly afterwards seems to be a huge help. Yeah. I mean, giving it a good massage, getting your partner, if you have one, to massage that area just to kind of work it in. But I think one of the worst things you can do is just give yourself the shot and go to bed, because then it's going to sit in that area and it's just going to sit. So
sit there.
Yeah. Last, we're like over time, which is fine, I'm sure everybody was happy. We are going to choose one person at random who dropped their emoji on how they're feeling for $200 off their full protocol order from Metro. So that's exciting. We'll tag you guys in the comments here in just a few minutes. But the last question I want to answer, only because we get this question a lot, is basically, why did I only get 2 vials of PIO? The reason is the following: because 2 vials gets you through the leading up to the transfer and then all the way to the beta. And so we don't want you to end up ordering, we're realists. We know that not every transfer works. We don't want you to end up with, some people take a break after getting progesterone and things like that. So what we do is we always give you 3 refills on all of your prescriptions. And so we always encourage you, just get those 2 vials. That gets you through, I think it's a few days. It gets you a few days beyond your pregnancy test. And then from there, you can order more when you get that good news. But we just don't want to kind of force you to have all this progesterone if for some reason you're not successful. So, okay. Well, this was wonderful as usual, Linda. I absolutely adore having you, because I feel like we really do just get to answer the real questions that people want to know. We don't, you don't sugarcoat anything. You're totally honest. I know so many times people are like toxically positive about some things, and it's, we really try, Linda and I try to join you guys so we can give you the real talk, the real how this is really going to go. And again, if you found yourself tonight overwhelmed, take a breath and do know that everything that we told you tonight, you would normally get told over a period of time. And so just take it in bite-sized chunks. Save this video for later. If you haven't even had your consultation yet, hit save. I think there's a way on Facebook you can save this video for later. So when you get your baseline call for your meds, come back to this video, watch it again, but just don't let the don't let information overload steal your peace. Remember, protect your peace. I might almost make that my show motto there, Linda. But we appreciate you guys. We appreciate all of your questions. Stay tuned for the winner. We'll tag you in the comments. And then, Linda, anything else for now? No? Okay. I think there might be a
thank you. Good luck. We were, a delay.
There's a little bit of a delay. That's okay. Well, it was wonderful to have you all. Have a wonderful week. I'll see you next week. Topic to be determined. So if you have a burning topic you'd love to discuss, let me know. But if not, best wishes to you all. We so appreciate being a part of your journey. Good night.